Right, so we're looking at the structure of the knee now, the articulations of the knee. So when we think about articulations, we're looking at what type of joint is this. So obviously there's three types of joint. Fibrous joint, being our skull is a good example, or our hip bones, because they've now fused, so that's a fibrous, fused or fixed joint. Yeah. Then we get synovial, slightly movable joint, which is cartilaginous. Classic example of that is in the spine, because we get white fibrocartilage there. Also the pubis symphysis at the front, like we discussed last time when we looked at the hip joint and the pelvis region. That's a slightly movable joint because it has a pad of white fibrocartilage there. So when we look to the knee then, there's no white fibrocartilage there. It moves, it articulates, so therefore it has to be a freely movable joint. So it has all the characteristics of a freely movable joint. So it has a membrane, it has synovial fluid, it has a synovial membrane within that, it has a joint capsule. Yeah, it has ligament supporting it. So they're all characteristics of a synovial joint and a definite need to know. Alright, characteristics of a synovial joint. So this is what we call a hinge joint, because what a hinge joint will do, just like a door opens and closes, it moves in one way really. So what this will do, it'll bend back and it'll come back forward. So it'll flex, because when we flex, we decrease the angle. Flexion means decreasing the angle whilst working in what we call a sagittal plane. Sagittal plane is anything that moves forward or backwards of the body. Alright, so that's flexion, that's extension. You can't hyperextend of the knee because it locks in position. It has a locking mechanism to prevent that happening, unless you bust your knee. Okay, so we can get flexion, we can get extension. However, when the knee is bent, we can get some lateral rotation and medial rotation of the knee, but only when it's bent. If the leg's in a locked position, it'll come from the hip joint. Okay, so there are our main movements of the knee. The only other joint that we've got to look at is the patella. So the patella is what we call a glide and sliding joint, because within that femur we have what we call the femoral groove, and our patella actually slides up and down that. So that's a glide and sliding joint. So a glide and sliding joint just moves a bit like that, and that's what our patella will do. And obviously we can get issues with our patella due to tightness of muscles, because it pulls the patella out of position if that femoral groove. And that's kind of the structure of the knee.